Imagine that you're sitting around, not really doing anything, and then out of a sudden you start feeling these skip beats and it feels uncomfortable. What exactly is it? Is it stress? Is it something that I ate? What is it exactly? Such and such, my family member, someone died. So could this be early signs? I need to go see my doctor. And then you ask your doctor, Doc, I'm having palpitations. What exactly is it? By the end of this video, I'm going to tell you exactly what palpitations are, when you should be worried about it, and that a lot of it is common, but this is how we work you up to make sure that your palpitations isn't due to something deadly that could potentially be life-threatening. My name is Dr. Isang, and I'm a cardiologist, and I use this platform to be able to discuss the importance of heart health and prevention. And today we're talking about palpitations because it's very common. And a lot of times people don't come in and say, hey doc, I'm having palpitations. They say things like I'm having skip beats, I'm having some trouble breathing, something doesn't feel right in my chest, I feel a fluttering, I feel a pause, I feel a thump. What is it exactly? This is palpitations. And what exactly is palpitations? Palpitation is just what you feel that is abnormal sensation of the way your heart is beating. And it can be completely benign, meaning that it is normal, meaning that it is nothing, but it can be something threatening such as ventricular tachycardia, SVT, atrial fibrillation. So we need to work you up appropriately so that if you have it, we can treat it and prevent something even worse from happening in the future. You can have a lot of triggers for palpitations. Sometimes people just have it where it's happening randomly throughout the day. There's no rhyme or reason. There's no specific triggers. But I have found that people who are having it consistently sometimes have triggers associated with them. This includes excess caffeine or caffeine itself. I've had some patients have palpitations or skip beats even with drinking decaf coffee. The fact that they're having it with that means that caffeine can be a potential trigger. Carbonated beverages, not just coffee, but energy drinks that are packed in significant amounts, sometimes above the daily recommendation of caffeine, can trigger it. Some soda drinks can also trigger it with the coloring, with the artificial and processed materials that's put into it. Stress is one of the biggest causes of it. That's why we always emphasize getting adequate sleep, anywhere from 7+ hours of sleep if you can. Understand that not everyone is going to be able to achieve that, but the more, the better. We also need to understand that a lot of things that we're putting into our body can also be triggers for it. A lot of the decongestions that we utilize, a lot of the medication that we take for one reason or another can lead to palpitations. For instance, some people can have an underactive thyroid and they take thyroid medications to help supplement it. But if they're taking excess amounts of it or supernormal amounts, then that itself can trigger it. And vice versa, someone can have a thyroid disorder where their thyroid is underactive and it's not working appropriately. And an underactive thyroid can sometimes lead to these palpitations. That's why it's always important for us to see a medical provider to make sure that if we have any potential risk factors that we get them treated so that we can prevent that and also understand what can be causing these palpitations, these skipped beats. So a lot of times people, when they come in with these palpitations, how do we work them up? The first step is going to be that history and physical examination, having them describe their palpitations to see if there are potential triggers, if there's any potential rhyme or reason where it's happening. Is it more in the daytime, afternoon, evening time? Is it associated with certain foods? That history just helps us to gather the story to help paint the picture, because sometimes they leave clues. They're repetitive. And a lot of times my patients don't realize it until they start talking about when they're feeling it, that they can associate certain life situations, certain foods that can be causing it. But with that history comes, how can we see it objectively? So if someone is having palpitations, we can...
Hey, I just wanted to let you guys know that you don't have to do this alone. If you're liking videos like this and want more thorough discussions and Q&A type videos, make sure to join the school in the community. The link is going to be in the bio.
You can actually see it on an EKG. So one of the first steps is to get an EKG, an electrocardiogram, which gives us a snapshot of about 6 to 10 seconds of what your EKG looks like, what your heart rhythm looks like. The biggest issue with this is that if your palpitations are not very frequent, we can sometimes be misled that everything looks good, that it's normal, when you're actually having true things. But typically in the EKG, we'll see things like PACs, or extra beats coming from the top part of the heart, PVCs coming from the bottom part of the heart, atrial fibrillation, ventricular tachycardia, or you're having a bunch of these PACs and PVCs repetitively or back to back. That's where the EKG can be very helpful if it does capture it. But we also understand that not everyone is going to be that lucky to get the EKG and it shows, boom, I know why you're having palpitations, or specifically, I know what your palpitations are. Because the first step is understanding, what is my palpitations? Is it extra beats coming from the top part of the heart or the bottom part of the heart? Is it pauses? Is it SVT? Is it atrial flutter? The more that we know, the more that we can tailor our treatment specifically for you and for that heart rhythm abnormality. But like I said, with the EKG, we don't always capture it. So what can we do next? I find that the referrals that I receive for people who are having palpitations, typically, hopefully, they've had a heart monitor that's lasting anywhere from 24 hours, but sometimes can go upwards to 72 hours, 1 week. When they come and see me and I'm still concerned, but maybe I'm not capturing enough, I can do a longer monitor, 7 days upwards to 30 days to capture when it's happening. Because a lot of times with the story that I'm getting is that these palpitations are occurring a few times a week or a few times a day, and some days are better than others. But I've also had patients who have gone several weeks without it. So the longer the monitor that we can get, the better chance that we have of capturing it to be able to help you guys out. So is there any scenario where you can imagine that you're having these palpitations? They're not occurring daily, they're not occurring weekly, not even occurring monthly. They're occurring a few times a year. Can we still rule this out? And the answer is yes. There's two different ways for those scenarios. The first one is if I am extremely concerned that these palpitations are life-threatening. And the best example of it is that if I have a patient that's having strokes, specifically recurrent strokes, cryptogenic strokes, I need to make sure that it's not due to a heart rhythm known as atrial fibrillation. Because if it is, I need to put them on blood thinners so that we can prevent those strokes from happening in the future. But I don't want to put them on those blood thinners if they don't absolutely need it. And that's where a loop recorder would be beneficial. And what a loop recorder is that we actually implant the heart monitor under their skin, and it can last anywhere upwards to 3 to 4 years. And I've had a lot of patients that we implanted that got diagnosed with atrial fibrillation, number one. Number two, they finally have an answer as to why they've been having strokes. And then number three, we can finally get them the adequate and correct treatment with blood thinners to prevent subsequent strokes in the future. That's where the loop recorder will be beneficial. But if I'm having patients who are also having a lot of syncope or passing out spells, or if all other testings have been normal, that's where the loop recorder would also be beneficial to help us understand what's going on and what's causing these passing out spells. A second option is if someone does not want to have that loop recorder placed, is having something like a smartwatch that can check it continuously, or my favorite is cardiomobile. And what a cardiomobile is like having your own pocket EKG. Hopefully, if you're having these symptoms, they're lasting for a minute, 2 minutes, because you can take out the cardiomobile, put your fingers on it, and it'll give you a rhythm strip as to what's going on right now. I've had 3 occasions over the past 4 or 5 years where a patient had their own and they were able to capture SVT and atrial fibrillation, and we were able to get them the appropriate diagnosis with treatments and potential ablations for those individuals. So that's where a loop recorder and a cardiomobile would be most beneficial. But outside of those heart monitors, what else can we do to further evaluate this? Some people can have palpitations due to a scar in the heart. Where there is a scar, you can have all these extra beats, abnormal beats occur. or not just a scar, an area of the heart that's not getting enough blood flow. So for those individuals, especially that have enough risk factors with the high blood pressure, diabetes, I want to check it a little bit further with doing a stress test to make sure that their palpitations is not due to areas of the heart not getting enough blood flow. I want to prevent a heart attack from happening. Number 2, I can check an echocardiogram, an ultrasound of the heart, to look at how well the heart is squeezing. If the heart is not squeezing well, it can be a nidus for palpitations to occur. If there's issues with the heart valves itself, it can be a nidus for heart palpitations and abnormal rhythms to occur. So stress test, echocardiogram can be extremely beneficial. With those testings, we also need blood tests. Like I said, sometimes it can be due to your thyroid not functioning appropriately. So we want to confirm this with getting thyroid tests. What other tests can we get? Want to get generic blood tests too, because we want to make sure you're not anemic, you don't have issues with your potassium or other electrolytes, your hormones are stable, and your adrenal glands, your endocrine hormones are also stable, which means looking at your adrenals, your thyroid, etc., to make sure that those aren't the reasons as to why you're having these palpitations. Look at you as a person. If you're having episodes more at nighttime, if you're overweight, if you're snoring, you want to make sure that it's not due to sleep apnea. So sometimes getting a sleep test would be very beneficial to rule out that being the cause of your palpitations, of those extra beats. So when should you be afraid? What are the warning signs? What are the red flags when it comes to palpitations? Passing out spells, happening frequently with exercise, chest pain associated with it, lightheadedness, dizziness, sweating, profound sweating, especially if, most importantly, if all these things are new. If all these things are new, you need to get seen as soon as possible to get the appropriate testings and possibly even a referral to a cardiologist for definitive evaluation and treatment. So in summary, palpitations are very common. They can be associated with certain foods that you're eating, stress, electrolyte issues, blood test abnormalities, but it can also be due to things like sleep apnea. It's very important for you to establish with a medical provider to start these testings as soon as possible so that we can figure out what is causing your palpitations, get it treated effectively to prevent something bad as a stroke from happening in the future. My name is Dr. Isang. If you got any benefit from this, leave a comment and let me know if you've experienced palpitations, how you were able to be diagnosed with it and treated.